So hello everybody. So we're up again to another third demonstration for today, which is the nasogastric intubation
So first, we have to assess
and
for the patient's
enteral administration. So I'm Rufus Carl Gonzalez, your student nurse, and before we start, we have attitudes to consider, such as we have to display readiness, we have to show enthusiasm and interest, we have to answer rationally questions correctly, and last but not the least is we have to accept criticisms. So with these attitudes, we will be able to build rapport, we will be able to establish trust, and most likely our procedure will be smooth sailing. So first things first is to verify patient's needs for enteral feeding, and next is to assess patient's skin breakdown of skin integrity, and as well as the patency and nostrils of the patient. So we have also to check if the patient nose is
in and out and
occluded.
nostril at each drop. One at a time.
Sir, can you please cover one of your nose? Okay, inhale.
After
Exhale.
assessing that, we're going
How about the other one, sir? Okay, inhale.
assess the patient's medical
Is
history.
it flowing?
Including, if he
Okay.
has a
So next is
unusual
to review the
and
patient's
we have to
medical
reflect
history.
mental status
We have
as
to
well
review
as, history
the
of
patient's
Then after that, we're
gag
going to
reflex,
explain
patient's
the
mental
procedure to the
status.
patient.
And sir, do you have any unusual
Inform
bleeding?
the patient how to
How about,
communicate
do you have
during
any,
intubation's blood.
gastric,
If you
nose
have any
surgery?
discomfort, then
Alright.
please just do a
So for the next
thumbs up
procedure,
sign, and if not, just
um,
point your finger.
for the
Then
next
we're going to
procedure
prepare all the materials
is we
needed
have
and
to explain to the patient the procedure. So sir, I will be the one responsible for the
then we're going to
NGT.
position
So,
the patient in
all
a
due
very
respect, sir,
comfortable
if
position.
ever I will
If
be
the
invading your
patient is
spaces,
in a comatose, then we
will
just
you
let
give
the
me
patient
the,
in a semi-false position
answer?
and provide the
Right,
pillow at the back of his or
will
her
you give
neck.
me the right, sir, to touch
After
you
positioning
anytime?
the patient, we're going to
Okay.
cover using a
So,
towel.
next is to explain to the patient or inform the
And after
patient
that,
the hand signals.
Wash my hands and
So
wear
sir,
gloves.
if you feel any discomfort, you can just sign like this and like this. Okay? Okay, sir? Okay. So, for the next procedure is you have to prepare the equipments needed. So, basically, it is very important to place the equipments near you so that you will not be having any hard time reaching it out. So, first is to wash your hands and then do the gloving. Okay.
And now, we're going to determine the length of the tube that needs to be inserted inside the patient. So we're going to measure it first. Start here at the outside, sa outer ng sa nose.
So for the next procedure is we are going to determine the length.
Once
the
you have
tube.
determined the length, we're going
So
to
to
place
determine,
the tape.
We have
Secure
to
the
take our tube.
to mark the lateral shaft of the mga
After we take our tube, we have to start
and then we
from the
will
nose,
the tube using
from the
a
nose
motor
to the ears, down to the siphon. And
And
then
then we ask the patient
we will mark this
flex
one
their head
with a
backward,
plaster.
and then we gently insert the tube. Once we have reached the nasopharynx, we're going to further insert the tube. And if the patient is experiencing a respiratory distress,
Ready,
it is
Mark?
important
Next part is to lubricate the tube.
that we remove the
So we have to
tube.
get small amount of it
And then
and
once we are
put
We are
approximately
inserting the
4
tube.
inches.
Secure the tube with
Roll the
a
tube in the
secure
lubricant.
placement by putting a tape.
And then, it's time to insert the tube at the patient's nariz. So sir, I will be coiling the tube, no, in case, so that it will not be moving sideways. So sir, can you please flex your head upward? Okay. Sir, just
Once
tell
you
me,
have
sir, if you
secured
will
the
be
tube
having
placement,
discomfort.
we're going to check
So
the
you will be
placement
feeling
of the tube
resistant,
by
no? Resistance.
irrigating or
So
injecting
upon reaching
water,
out, reaching at the
tube with density
nasopharynx,
of air.
so you will instruct the patient again to flex his head forward. Okay, and instruct the patient to swallow. Sir, swallow normally, and as you swallow normally, you can gently advance your tube until such time that you will be reaching the xiphoid or the tummy.
Then we're going, after injecting density after auscultating to clasp
Okay,
or cup
so for the
the
next
tube
procedure,
placement,
we will be checking the
and
tube
then
placement.
placement in the-
So there are
in
certain
the
ways to check,
dressing
no?
of the
But
patient.
in my case, I will be using the syringe. So get the syringe. Withdraw. Make sure that it's 10 cc.
Then we're going to
Then
dispose
insert
of
the
the
syringe.
materials used and then we remove the gloves.
So as we pump the syringe, we have to listen, auscultate.
We're going to perform hand washing
Okay.
and then we document the procedure
Okay.
and reposition the patient as well.
Right.
So for enteral feeding, we're going to assess
So
the patient
the
for
tube
the,
is properly
for the
placed.
need for enteral
Next
feeding.
is to
And then
aspirate.
Auscultate the patient.
Aspirate
by
for
enteral yes.
gastric contents. So insert the suction. And then,
For bowel sound. Auscultate the patient for bowel sound.
okay. So if there are any prescriptions from the doctor that the patient needs to be to undergo X-ray, so we have also as well to we have to prepare the patient as well. So for the next step is to clip and cap the end to avoid cross contamination. So it goes like this,
After auscultating, we're
and then secure.
going to obtain a baseline data, including the laboratory values, as well as to determine whether the patient is having any abnormalities. Then we're going to verify the physician's order about the procedure, and then we're going to explain the procedure to the patient, then prepare the materials needed. Then we're going to position the patient and in a high Fowler's position, and then we're going to wear gloves and perform hand washing.
Okay. After securing, we have also to secure the line, the tube line at the gum of the patient. Okay. Okay.
to check for the tube placement. After checking for the tube placement, then we're going to check for the
Next is to
gastric
reposition the
volume,
patient.
gastric residual volume. And if there is any presence of gastric residual volume, we're going to measure
Remove the
it.
gloves.
And now we're going to
And
start
washing.
for
Last but not the
enteral
least is to
feeding by
document the
irrigating
findings.
first the tube.
So for the next procedure, we have here the Enteral nutrition administration.
Irrigate the tube first
So
with
first
water.
is we have to
And before that, we're going to
assess
pump
the
first
patient's
the
needs for enteral feeding. Next is to auscultate.
And then we're going to start now for tube feeding, or for the feeding rather.
Okay. Okay. Okay.
Now
So
we
for the
wait for
normal
the- once
bowel sounds,
feeding is
it is 10 sounds per minute.
We're going to irrigate
Next
again
is
the
to
tube.
obtain baseline data. We have to obtain the weight. We have to obtain the lab results.
After
We have
irrigating,
to
we're
check
going
for
to
any abnormalities in terms of electrolyte and as well the metabolic abnormalities. So next is to explain the procedure to the patient
And then
and to review the doctor's order. So sir, I will be
then we let the
feeding
patient
you for
maintain for
today.
a high polar's position
So
for
just the same as usual
30
sir.
minutes to 1 hour to promote
So next is to
digestion, and then
prepare the
remove
equipment
gloves,
And to position the patient
and
in high
perform
founders
hand washing,
position.
and then we also
Okay.
have to dispose all the materials used.
So first
And we
is
also document
to
the
check
procedure.
the tube placement. But before checking the tube placement, we have to wash our hands first and we have to don our gloves. Okay. Since the tube is already used, no, we have to check for any residues. So check the tube placement, check for any residues. So if there is any residue present, so we have to irrigate it with okay. So as we pump, we have to listen, auscultate as well. Okay. So the tube is in correct place. So if there are residues, we have to irrigate it with water. Irrigate it with water. Okay, we have to do it step by step, gently, so that the patient will not be. Okay. Next is to start the food feeding. Sir, I will be taking your food, Nasara. Okay. So gently. Okay. Since there are residues left, we have to irrigate it again, once again with water for future purposes. Okay. Sir, just signal me sir if you feel any discomfort or that. Okay. So gently. Okay. For the next procedure is we have to clip or cap this one to avoid cross-contamination. Place it properly. Reposition the patient and maintain the position for 30 minutes to 1 hour. And last but not the least is to document results and take off your gloves and wash hands. Thank you.